Uh, uh, Urvashi, I made you host.
Yes, sir.
Team Urvashi Bagela is a clinical psychologist and also a NLP master practitioner. So she is going to start with primal therapy, and after that, Payal will be taking about the four important interventions. Okay, over to you, Urvashi. Over to you. Uh, Thank you very much.
Okay,
I'm just
okay.
leaving.
Thank you. Yeah. So, hello everyone. My name is Urvashi, and I'm going to give you few glimpse about primal therapy, about their definition and few benefits. So, let me share my screen first. Just give me a minute. Kainat, Ji, can you just tell me? I just need a little help. How to share the screen?
I'm not really aware of. I'm sorry.
Really?
Yeah,
Yeah, just hold on. Just hold
Urvashi, I
on.
can
I'll tell
help
you.
you.
Yeah,
Click
ma'am.
that green color button down there, right? Share.
Okay, share one. Okay.
Okay. It has been disabled. Okay. Do you have that enabled? Is it enabled for you?
Yeah, okay. This is screen.
Windows screen, or you have three options, right?
Yes.
Yeah. You can choose that one.
Okay, then after.
What are you getting after that?
Yeah, just desktop one and
No,
Safari.
which one you want to share, that one alone you choose. Is it in the desktop, the file you want to share?
Yes.
Then you can, yeah.
There is not.
Windows screen or Windows or share everything, something like that. All three will be there. You can choose accordingly.
Okay, is Fatima ma'am available or not?
Yes, yes, tell me. I'm here.
Ma'am, can I share in your WhatsApp? Then you can share it to the screen.
You can share me, but before that, you have to make me co-host.
You can share, Urvashi, just like that. You can just click on that screen.
Okay, I'm making
Desktop.
co-host.
Urvashi, I think you are a host now. You will be able to share it with this option share, the green colored one.
Yeah, but it is not going to showing option in this. I have tried.
Did you open the file which you are about to share?
Yes, yes, I did.
So when you click on share option, what does it say?
It's okay, okay. I got it. I got it.
Click on that desktop or something like that.
Yeah, I'm doing it. Not showing still.
Urvashi, relax. हो जाएगा, ठीक है? You just click on option share and tell me what is coming. Just click on the option share.
Oh, Okay, let me do it.
Can someone give me the host? I'll just let her,
Your name, ma'am?
Vidya.
Okay, just hold on.
It is not.
Can make me the co-host or something.
Ma'am, Vidya Ananta Kumar, right?
Yes,
Yeah,
exactly.
I'm making you co-host, okay?
Yeah, fine.
Actually, this is not opening. That is the issue.
Yeah,
It is showing, but it is supporting.
1 minute. 1 minute.
Urvashi, you can do one thing, na? You can make Vidya ma'am also co-host
I think I
so
make
that
them.
she can share the screen. Yeah. Vidya Ananta Kumar.
Okay, okay, let me do it.
Yeah, co-host.
Yes, I did.
Okay.
Okay, perfect. Team, please mute yourself, please.
Okay, I'm just okay, did you choose it after sharing, after clicking the share button, you have options, right? Who can
Yes,
share host only
it
some
is showing also, but it is not opening. Like I have tried this also.
Urvashi, what happens sometimes that if your network is poor, then sometimes file doesn't open.
Okay, but my network is working really fine. I can
okay.
see the file also, but I'm not able to open it. That is the issue.
Urvashi, share
Urvashi,
me the
can you
thing in
share it?
WhatsApp. Share
Can you
me in
share it to
WhatsApp.
me, Urvashi? I'll share it in the screen, then you can take it forward.
Okay, can I share with you in WhatsApp?
Yeah, go ahead, no issues. Could you make it slow? I'm just attending one training.
Is this your number where I've sent it?
Yeah, 1 minute. Yes, yes.
Okay. See, I have shared.
Okay. Just a minute. Give me a minute. Okay, now I'm sharing the screen, Urvashi.
Okay.
Okay.
Yeah.
Is that visible
Yeah, it is. Thank you.
for
Thank you.
everyone?
Yes,
Okay.
thank you.
Yes, yes. 1 minute. Let me see whether I can. Okay. Okay, you can go ahead now.
Yeah. So let us talk about the primal therapy. Okay. So primal therapy was developed by Arthur Johnner. He is an American psychologist in the late 1960s. Okay. So he approach was based on a repressed childhood emotions, particular on pain and trauma that is stored in the body and can affect mental health. So the therapy is aimed to help individual access their repressed memory, like which is connected to the past, okay, the painful, which we don't want to remember, and like they have to be available in our subconscious mind or unconscious mind, you can say. So the therapy aims to sorry, who is doing this?
Yeah, please stop. Somebody is, I don't know who's doing that green mark.
Okay, so he published the one book which name is The Primal Scream, and he published in 1970s popularized the therapy and its controversial method, which often includes patients screaming or vocalizing their pain during therapy session. Ma'am, can you slide up a little bit? Okay.
On? Yeah.
Yeah. Okay, so the approach garnered attention both from psychological community and the public. It is also faced criticism over the year for its unorthodox method and limited scientific support. The reason is people do not support this therapy because of a few people which have thought like screaming and vocalizing. It's not looking good, like it is not good for the society also, who do not support the screaming, take out your anger. So that's why this is called to be a controversial method. Okay, so let us go for the definition primal therapy. Okay, so as we have discussed above also, the primal therapy is a form of psychotherapy developed by Arthur Jano in the late 1960s. Okay, so designed to help individual access and release repressed memory.
Urvashi, 1 minute. You can just take control of my screen now. Just accept what I've given there in your screen. Then you can scroll it.
Okay.
Got it? Okay. Now you can scroll up and down as you like.
Okay, thank you. So, in particularly those originated from the childhood trauma. Like many times people have feeling like a childhood trauma, depression, unhealthy family environment, personal issue. Okay, so these are the things. Jano believed that this unprocessed emotional pain or primal pain can lead to various mental health issue, including depression, anxiety, and even physical alignments. It is okay. So the therapy is based on idea by revisiting and fully experiencing these painful memories, often though intense emotional expression includes screaming or crying. Patient can re-experience the trauma and release the stored emotion. Like the person who is facing these type of emotional trauma, they can be like take out all the things which he or she is facing inside. Okay, so the goal is the goal is to help individual achieve emotional catharsis and healing by confronting and integrating these painful experiences, which are those to be locked away in unconscious mind, which I have explained in previous like introduction also. Like these memory are still in our unconscious mind, like something is happened in our past which we have remember, but it's not affecting in our daily day-to-day activities, right? Like if something is related to the past thing, if something glimpse of the things it is explained or it is experienced to the present also, so these things literally trigger instant, like okay, these are the things which happened in the past also. So that is the reason. So there are the key aspects of primal therapy. Accessing repressed emotion. The therapist help the patient to uncover access deep-seated emotional pain that they may not even be consciously aware of. So that there is the things which we do not have remember. So they help us to take out all the things. Then we will come to know, okay, these are the things which we have pent up, like be being in so many years. Okay, so emotional expression. One of the most distinctive features of primal therapy is emphasis on physically expressing repressed emotional, such as through screaming, crying, or other intense form of emotional release and catharsis. The ultimate aim is emotional catharsis, a release of repressed feelings that lead to healing and reduction in mental and physical tension. It's like a one type of activity to take out all your emotional and physical tension. Okay. Although it was a groundbreaking and widely discussed in 1970. Primal therapy has been controversial and has faced criticism from some psychologists for its lack of empirical evidence and scientific validation. As I have said before, like screaming and take out all your things is not like a professional or validate for few people because they don't think so it is good for the society to take out their extreme anger or pent up their emotional in a very extreme level. Benefits of primal therapy. Primal therapy is said to offer several patients benefit. Through it is important note that its effectiveness has been debated. The therapy is not widely practicing in mainstream psychology. That said, proponents of primal therapy believe that it can lead to significant emotional and psychological healing by addressing deep-seated pain and trauma. So there are the few things which include in benefits are emotional release and catharsis. One of the primary benefit of primal therapy as emotional release that patient experiencing by confronting and expressing repressed feelings such as anger, sadness, and fear. Okay, so these are the basic thing when a person with the it's like come to the therapy, he is going to express their anger, sadness, and fear through confronting. Patient may feel a sense of relief and emotional liberation. Okay, the cathartic release can feel a weight lifting from their emotional state, like they have been pent up all their emotional and painful memory in their unconscious mind, so they can be helpful to release all the things. But obvious, if we will take out all the painful memories, then of course we will feel like a weightless, like we have shared to someone who can understand. Okay, reduced emotional numbness. Many individuals who have repressed trauma may experience emotional numbness and detachment. Primal therapy aim to break through this barrier, allowing individual to reconnect with their feeling in genuine and unfiltered way. You know, sometimes these memories and emotional, it's affect on our health also, like physically also. When we feel depression, it is literally connect to the physical also. You will feel panic attack, okay, which is connected to our heart, okay, our shoulder. You will feel palpitation if it is triggered to your memories or your unconscious mind. Okay, so the second thing is healing from childhood trauma, addressing early life pain. According to Janov's theory, unresolved trauma from early childhood, such as neglect, abandonment, or emotional pain. Sometimes parents do not be able to take care of their child, like they can't be most active on their activity, what they are doing, what they are not. Okay, so they are sometimes not emotionally connected to them, so it can be persist into adulthood and caused various psychological issue. Primal therapy seek to uncover and heal these early wounds and potentially lead to long-term emotional healing. Okay, so in this few aspects they can be able to take out their things, like their problem, what is bothering them from the long time, what they are seeking, what they really want in their present time, what they can do further in their future, and what is they are facing in their present also. Processing unconscious pain. Many people carry unresolved pain with being unconsciously aware of it. It's like a most of people, okay, you and us also there is something which are carrying us, which are not aware, because it's not bothering to our day-to-day life. It's like a past thing which is in our unconscious mind. Primal therapy aims to make unconscious pain conscious so it can be processed and released and leading to healing. As I said, if we face something in the present time, it will be feel like a trigger. Sometimes we feel like a shivering, panic, palpitation. Okay, like we feel like the whole picture is remembering in front of us. So these therapies help to literally release our pain and leading to healing. Reduction in anxiety and depression, relieving chronic emotional tension by confronting painful memories and expressing repressed emotional. People may experience a decreased in chronic emotional tension. Okay, for some this can reduce symptoms of anxiety and depression that have stemmed from unresolved trauma, which I explained in the previous point. Feelings of relief, the intense emotional release during a primal therapy session often result in immediate feeling of relief or lightness, as the emotional burden of repressed pain is temporarily elevated. Enhanced relationship, improve emotional expression. Okay, many people who go through the primal therapy report feeling more open and capable of express their feeling in a healthy way, which can improve communication and emotional intimacy in relationship. Okay, there are the few people when they are carrying the burden of the past thing or painful memory, they literally do not socialize. They pent up all their memory up to them, and sometimes they are not able to express to their family, friends. So through this therapy, they can be open up to their feelings, okay, because they are no one is going to judge them. So through that they will be more open to the communication, and through that they will be leading to the good social life and communication and intimacy also. Reduce defense behavior. Repressed emotion often lead to defensive behavior such as shutting down, withdrawing, becoming overly guarded. By releasing this emotional baggage, individual may become more open and less defensive in their interaction with others. You know, sometimes we literally noticed in our life also, if someone will ask to our like something, we literally feel irritated, like, do not ask me this, I don't want to share about this. These type of our reaction in regarding those person. Okay, so these therapies literally help to shut down our negative behavior towards it. Physical health benefit, reduction of somatic symptoms. Chanov believed that emotional pain can be stored in the body, manifesting as physical alignment like tension, chronic pain, or fatigue. Of course, if we pent up these emotion pain, it will be, of course, help like effect on our physical also. We will feel chronic pain or like panic attack or all these things. Some individual report that after undergoing primal therapy, these physical symptoms decrease, possibly due to emotional release and the body's return to more balanced state. Like they are able to be physically healthy and mentally healthy also, and they can be more concentrate or their day-to-day life activities. Increased vitality, by addressing unresolved trauma and emotional pain, some individuals feel a renewed sense of vitality and energy. Released the stored emotional tension can be lead to increased overall well-being. Seventh, reduction of repression and psychological blocks. The therapy aims to unblock area of psychic, emotional,
लेंगे था 15 फरवरी से हाँ टिकट चल रहा
yeah. potentially elevating mental health issue like chronic fatigue, depression, or unexplained physical alignment that may have been tied to unprocessed trauma. Physical healing. Some proponents of primal therapy argue that release of deep emotional pain can physical effect as well, like elevating tension, reduce stress related physical system like symptoms like physical tightness, muscle tightness, as told you, like you will feel like your shoulder or whole body is like literally on a tight form, or headache, like your head will be literally throbbing, and even improving general health. Sense of liberation. For those who feel emotionally stuck or trapped in negative patterns, prime therapy can offer a sense of liberation. Letting go of past hurts and confronting painful emotional can feel like a weight has been lifted. Of course, you cannot be easily let go of the past. Like you will feel like, okay, am I able to? You feel like a questioning to yourself. Am I able to take out from these things which I have been carrying from past too many years? So, this therapy is literally being somewhere helpful to you. Alternative to traditional talk therapy. Unlike traditional talk therapy, which may involve a lot of cognitive work, processing thought and belief, primary therapy is experiential and focuses on body's role in emotional expression. For some, these approaches feel more direct and transformative. So these are the things which can be helpful. Like you are literally have a chance to express all your things. That's why the primal therapy, it's like a comfort zone. You can take out your all the emotional and physical alignments also will be feel like a on a lightweighted. Okay, so you can say the primal therapy is much better, but not on the top. While these benefits can be profound, primal therapy is not for everyone. It can be intense and excessive, repressed emotional can be challenging and overwhelming. Sometimes when you are going to confront or experiences these things, it can be triggered also. It can be effect of your health also. Okay, it is important to approach it with the guidance of trained therapist and a willingness to engage deeply with one emotional world. So it is really important. Do not experiences like on a normal way. It is not good for your physical and mental health also. So thank you. If anybody is having any doubt, you can ask, or we can go ahead with the next one.
I have a question.
Yes.
Uh, like Urvashi, how this therapy is different from psychoanalysis that is presented by Sigmund Freud and Joseph Bright, because the core theory is look like same here. So, would you like to like explain how it's difference in its application or in its theoretical background?
See, the difference is the only thing like which I have explained in the introduction section, right? It is feel like whenever the you go to the therapy session, they will allow you to scream or take out your all the tension. Okay, you can just take out all your anger, which is not a beneficial, or you can say the most reliable thing. But you can say like if we pant out all your emotional in one thing, you will feel really relaxed. It's like a quick therapy, you can say, the quick realization or quick reliefness also. But it is not on the top notch. Okay, so that's why the thing is not on the top four, or you can say the top first also. These your
Like you can say it's a short-term therapy with the
yes,
similar content, but it's
yes,
brief
yeah,
or according to situation. So
yeah,
like as we believe catharsis is really helpful in all
yes.
type of
Yes.
therapies. Uh, but here we allowed like our patient uh, to scream, to express their anger the way he or
Being
she is
on a
feeling it.
being on a professional level, or you do have your own firm, okay, you can do that. But if you are somewhere like you have organized on your home, you cannot allow, right? It will be bother to the neighbors also. So that's why itself it's the controversial. That is the reason. Like the last time mentioned, I also it is important to approach it with the guidance of a trained therapist. So it is not too bad if the patients take out all their emotion. It is totally fine. Like in 3 session, he or she itself will feel like okay, there is somewhere I'm improving. So it is.
Please mute.
Is there any question?
Yeah, so Urvashi, I would like to know, Alzira here.
Yeah.
So the catharsis which are done at that time. So what is the mode of it? Like how it is done? You try to scream, you try to shout, but how do they do that?
Okay, means how to start the therapy, right?
Huh. Means how they will start shouting. So what is it?
First of all, we can start with the rapport building, right?
Hmm.
The way we do with the every client, right? Or we can first build the rapport, then we will ask them few questions, then we can give them assessment also for a closed ended question. Like we cannot ask the direct one, it will trigger or it will affect on their health also. So through assessment, we can come to know, okay, these are the points which can be triggered to the patient also. Then after we will go for the open-ended. We will ask them slowly. Then other thing, we will give them chance to write about themselves. Okay, we will give them pen or paper like a short activity, like which few things triggered to them, like 1 or 2 or 3 points. So through that we can go ahead with the session also. Okay.
Hello?
Yes.
Okay, thank you, Urvashi ma'am.
Yeah.
I think we have very sufficient time. We have limitations. So I think now it's Kakisha ma'am time, right?
Yeah.
Yes, ma'am.
Yeah. So Urvashi ma'am, can you please make her co-host so that
uh,
if she want to share anything?
Can I add few things?
No, I don't want to share anything, ma'am, so it's okay.
Okay, okay. Then you can go ahead.
Okay,
Yeah,
so
please.
everyone present here, today we'll do an activity. So for that, I would like everyone to follow the instructions. I would request all of you to first go to a quiet or private place or anywhere where you
Uh,
feel secure.
Excuse me, ma'am. Just to
Yes,
interrupt
ma'am.
you because you're going to do a very fantastic activity right now. So I am requesting everyone as far as possible, please come to video. Please switch on your videos.
Yeah, that would be great if you
Yeah,
can.
yeah. Please, everyone. Please try to come on video. Yeah. Okay, ma'am. Please. I
So,
think they are.
okay. So first, now what you need to do, if you want, you can dim the lights or adjust the environment to your comfort. For example, if anyone wants to dim the light or maybe switch off the fan or do anything that makes them comfortable in the environment, please do so. Now, you guys need to be open and non-judgmental towards your own emotion. You don't need to judge your own emotion. You need to be non-judgmental about that and sit down very comfortably. Now, Take deep breath so that your body feel calms. Inhale for 4 seconds. Maybe please inhale. Everyone inhale and hold. Please exhale. Please exhale for 6 seconds. Now allow your mind to think of any memory where you wanted to express your anger, but you couldn't do it due to any reason. Just think about that event. While thinking about the event, anyone of you is feeling anger, you can just express it vocally, or you might even, if you want, you have a pillow, you can punch it, but not in a way that you harm yourself. I hope anyone who is feeling among you naturally that now I don't feel good, I feel very angry, do the needful and sit quietly. And write in the chat box that you have done the needful, sorry. Um, if you have completed, please write, doing the needful, please write done in the chat box.
I cannot write Got it. My message is not going
Okay,
there.
okay, it's okay, it's okay, ma'am.
Yeah, same.
Okay, for those who have already completed doing this thing till now, I would request all of you now to reassure yourself that that okay, whatever happened, it's okay, and it's important to let go of the past. And you might take a page and a paper and write if you feel like writing about that thing. It would be better if you write whatever happened to you and the arguments if you still feel angry about it. And after that, you might just drink water and listen to your favorite music. You might just leave for a while the room and then join back again after drinking water and just listening to a 2 minutes music or 5 minutes of your favorite song, any favorite song.
Ma, ma, water.
So now everyone has done it, right? Or is someone still left?
Yes,
Okay, please continue.
I really like it. I feel like my anger sipping out. It's amazing. Thank you so much.
Welcome. Did you listen to your favorite music?
No, I don't like music.
Okay, that's fine. So now you can just rest for a while. 2 minutes, you can just close your eyes and relax. Like we do meditation, just do meditation. Don't think of anything. Just do a 2 minutes meditation and then we can end the activity.
Okay, as you wish. Okay,
Thank you.
welcome.
What does this activity called?
Okay. This is a primal therapy. In this therapy, you basically have done for frustration, but this therapy actually targets many things including emotions, like any past childhood trauma you went through. So for that you have to that you can cry if the person who is like cry like who, for anyone who you have said that please think about any childhood trauma. If the person is crying, just let them cry and just let them naturally they should stop when they feel okay, I need to stop crying, I'm okay now, or it's okay. Just let them stop for like this only. There are many things including in this, like fear, emotion, frustrations, and furthermore. So you can, if you practice this, you might feel day by day little better of whatever you went through about that incident where you couldn't do anything. And every time after doing the thing, if something in your childhood happened that makes you not feel safe, so you just reassure yourself after completing this, before drinking the water, listening to the music. You just make sure you just tell your safe self that I'm safe and I need to let go of the past things.
Okay, thank you.
Miss, can I ask one question?
Yeah, sure.
I wanna add one thing. Sometimes I want to cry without any reason for no reason. So, hello.
Yes, I'm listening to you. You're
Okay,
audible.
okay,
Yeah,
okay.
then this the crying, is it a part of like screaming crying? It's all emotional outlet. So that comes
Yeah.
under this therapy?
I want to cry without any reason, but I can't do it. What should I do?
Are you guys asking to me?
No, she's asking to me, but for that, I guess you should consult a psychologist for that who can just check out if you have any past traumas unhealed. That would help you out. The psychologist will take the history, case history, and would try to understand if there is any past trauma that is affecting you, which you are yourself unable to understand.
Yes, exactly. But I'm a psychologist too.
Okay. Mm,
So I think for that you can call any of our emo care leader and we can give you counseling for that. So that's not a problem. So I think
Yes.
that would be the best to do. Yeah, thank you.
thank
Thank you.
you. Anyone
Yeah.
has any questions?
I
Yeah,
want
can
to say one thing, that when I am disheartened, when things are not going smoothly in my life, when I
Hmm.
face any some problems or something, when I'm a bit disheartened or sad, then I prefer reading spiritual books or I watch funny videos like animals or any cute videos, funny, which makes me laugh, and then I start focusing on my work. I think that will work wonders.
Yeah, if it's making you feel relaxed and better, you should do it.
Yeah. Urvashi
Uh,
ma'am, can you make me a co-host so that I can share the screen?
Yes, sure.
Excuse me, may I ask one question from Kakasha ma'am?
yes.
Thank you. So, ma'am, my question is that the activity that you just introduced to us, as a counselor, if suppose a person with anxiety comes, right, then like we can administer this activity, like only if the issue is of anxiety. So, if I am not trained in this therapy, primal therapy, but like I can conduct this activity only. Can this be done, or first I need to take proper training in this primal therapy and then I can do that?
I guess
What do
you can take the therapy for like sorry, so you can take training for the therapy from the professionals that in the institute itself, MOK Institute, or from anywhere. You should take the training first. Then you should do it.
Okay, fine. Means the whatever activity you have just told. First of all, thanks for it a lot. It was wonderful. So, like, it is beneficial for us right now because, like, for us only. But for administering it, you are suggesting that we should first take training, right?
Yes.
This is a
Okay,
very small time to, learn this. I mean, this is just an overview of things. So if you want to get into details, you can talk to any of the MOK leader. So let's go ahead with our next presentation. So, hello everyone. I am Payal Modi and I am a psychologist in MOK. So today we have already seen primal therapy by Urvashi ma'am and Kaikasha ma'am. It was elaborative and we also saw how to conduct it, a little bit, a glimpse of it. Now we are going to see some more interventions. So let's begin. So what are interventions? When we are dealing with any therapy, so the psychologist has to intervene seeing the problem. What is it? And we have already seen the primal therapy. Next, we are going to see sand play therapy and miracle question therapy. So, have anyone of you heard about sand play therapy? Does anyone know? So that
No,
okay. So I'll explain what is it. I'm not going details into who, where is it originated from, and what is it. So I'll just get straightforward. What does it mean and how does it work? So, how does it work? When we say sand play therapy, this is not about going to a beach, but it is done in a psychological clinical setting. So, the materials used by the psychologist are, it is a small sandbox, and usually it is a tray filled with sand and a variety of miniature objects, such as maybe some figures, animals, plants, vehicles, buildings, and any other symbolic items which the therapist may seem it is useful. So how does this process work? It is, though it is a symbolic representation of emotions and experiences, but how does it work? Okay, what is the process of it? The therapist first provides the client with the sandbox and the figurines, whatever the figures, inviting them to create a scene of a world in the sand with all those figures and animals, whatever it is. Then the therapist observes without interrupting or analyzing, creating a safe and non judgmental space. They let them do whatever he is doing. We don't interrupt in between. That is the main thing. After the scene is completed, the therapist may ask many open ended questions to encourage the client to reflect on their creation. What have they done? So only if the client is ready for it and he feels comfortable. So over time with repeated sessions, what happens? We can see some patterns that is there or some conflicts or potential resolutions that could be done. So this is how it is going to work. So yes. So now this therapy, sand play therapy, how to which clients can we use this? So first of all, can you all tell me, seeing only hearing the name sand play, to which of the clients could it be worked upon? Sand play therapy? Yes, come on.
I think I think it can be
It's
worked upon
children.
children.
Yes,
Children,
well, yes.
Yeah,
So
children.
it is a combination of play therapy
when
and
they
art
are
therapy.
when they have experienced some traumatic.
That true. That's right. That's right. So in children, we use this to assess emotional issues like anxiety, grief, or any kind of trauma, as Jyoti ma'am said, or any behavioral problems. Children, see, they often lack behavioral skills to articulate, deep buried emotions. And so sand play can provide an expressive outlet. But it can also be used with adult for those clients dealing with PTSD or any trauma or repressed emotions. It can access your unconscious feelings and allow symbolic resolution. So, should we discuss one scenario so that we understand how does it work? Should we go ahead with that?
Yes,
Yes,
ma'am.
ma'am.
Yes, please. Yes, please.
Yeah. So, I'll take a scenario of a child, and he may be referred to a counselor for maybe aggressive behavior at school. So the counselor, after building the rapport, the initial things, the child, he could be given the sand and the figurines, whatever required. Maybe the child, he could place a knight figurine in the middle of the sandbox, surrounded by soldiers with weapons. In one corner, there's a small unarmed figure hiding behind a rock. So now the therapist could gently ask, what is happening here? Can you please explain? And kids are so they're very excited to explain what they have done. So the child may respond, the knight is protecting himself because everyone wants to hurt him. The small figure is scared. Over time, the therapist notices that the child often depicts themes of fear, isolation, and danger in their scenes. This might indicate that the child feels threatened or unsafe in the environment. So we can dive deep into that environment where the child is there and what are the danger or fear that he is going through. We could, in counseling, we can get through that. And in later session, The child starts creating scenes where the knight is no longer surrounded and the small figure also comes out of the hiding. This could reflect healing and a sense of safety as the therapy progresses. So this was one, and one case study is there in the screen. So that is a very small one. I mean, I've not elaborated on it. So since the time is less, if time allows, I'll go through some more case studies. But the next therapy is the miracle question therapy. Now, when clients they come for therapy, they usually think there is some miracle is going to happen, but it doesn't happen all the time. But this therapy intervention, it has been named miracle question therapy. Let's see what is the miracle. So the core idea behind this technique is rooted in solution focused brief therapy. This is a therapy, brief therapy, solution focused, which emphasizes the client's strengths and future goals instead of focusing on the problem itself. We don't focus on the problem but see the goal where the client needs to reach. So how does it work? What is the process? So the therapy, first we will have all our rapport building, and then the therapist introduces the hypothetical miracle questions like, imagine that you sleep tonight and tomorrow morning when you wake up, imagine a miracle happens overnight and your problem is gone. So what's different now? So the client visualizes their ideal future without the problem. Here, the client doesn't focus on the problem, but he focuses on the future without any problem. The therapist helps the client identify specific practical changes or actions they can take to move toward that future. The focus is on small achievable steps. We don't say that the client is here and then in one go it will go there. No, we focus on small achievable steps that can be achieved to large changes. Now, when this can be used? See, this can be used in depression, anxiety, or mainly in relationship conflicts. This can be used very well for family therapy. And it is used when we are working with clients who are open to exploring solutions and reaching actionable goals. So, for example, let's take a scenario of, let's take another one. Maybe there is an adult who is struggling with low self esteem and lack of motivation. So, suppose the therapist asks, let's imagine that tonight while you're sleeping, a miracle happens and your problem disappears completely. When you wake up, how would you feel? How different would be the situation? What would be the first thing that you noticed? So, the client responds, I would wake up feeling refreshed. I would get out of the bed feeling like it's not a core. I'm just getting out of the bed normally. I would smile when I look in the mirror. I would feel good about myself. The next question of the counselor would be, what else might be different? So the client might say that maybe I would go and meet my friends. I'd be more confident about trying the job. So I will not isolate myself and meet people. So now what would be the next step? I'm just telling briefly, how does the counseling session goes on?
Ma'am, sorry to interrupt, but can you just made it little quickly because it's
Yeah,
all.
yeah, sure.
So if you will not do it, then people will be left early.
Yeah, sure. So the therapist helps the client identify small practical steps toward the vision. Like he might ask, what's one thing you could do tomorrow to make getting out of bed easier? Or he could ask, what could you do this week to connect with a friend? We are not talking about a year, a month, but what you could do tomorrow, what you could do next week. So, as the client implements these small changes, they build self confidence and start to see progress, reinforcing a positive outcome. So, now So there are many aspects. And one more thing, that sand play and miracle question therapy, they also work and complement each other. So can I give one example? Yes, for some clients, like suppose a child in sand play therapy, suppose he may create a scene where they feel stuck or trapped. Okay, so the therapist might later use the miracle question to explore. If the figure in the sandbox could escape or feel safe, what would that look like? So here we are combining the sand play and the miracle therapy together. So this integrates both symbolic and solution based focus techniques. So, and also in the sand play therapy, the focus is on symbolic, subconscious exploration of the buried emotions. And in miracle therapy, it is goal oriented and future focused. And it is best for trauma, children, non-verbal clients, like with adults as well. And miracle question therapy, clients were ready to set goals and take actions. And the process is for sand play therapy, it is creative, non-verbal, intuitive. So why use these therapies? So sand play helps trauma, grief, and emotions that are difficult to verbalize. And miracle questions builds hope, clarity, and actionable steps toward change. So both therapies offer unique tools for healing and growth. So thank you. I'm done with this thing because we are short on time. Otherwise, I had lots of case studies to discuss with you all, real life case studies. But due to the shortage of time, we are winding up early. So if any of you want to contact or any questions, we might take it later on, or maybe over phone, anyone wants, so they can call up for anything. Thank you very much. So Urvashi ma'am, are we winding up this session?
I think I will just end it simply.
Yeah, okay. So thank you everyone. So we had a nice training session today. I hope everyone liked it and had a lot
Thank you.
of
Thank you,
new things.
Payal. Thank you
Yeah.
for sharing your, uh, it would be great if we had a case study today being and
Yeah,
all
I
the
had case
implementation
study.
area.
Yes, but
Thank you so
because
much.
of the time. So if anyone wants to connect, they can. Thank you so much.
Thank you, everyone.
Thank you,
Thank
everyone.
you. Thank you,
Thank you all,
everyone.
guys. Good night.
Thank you. It was wonderful.